Understanding Agoraphobia. Hi, I'm Chris, and I help people that suffer from agoraphobia, anxiety, and panic attacks to take control of their minds and their bodies. Agoraphobia is a serious psychiatric disorder that afflicts millions of adults. If you or someone you love struggle with agoraphobia, you know that it can be a severely debilitating disorder. Individuals with this disorder are frequently portrayed as having a fear of everything. However, the underlying issue for agoraphobics is the often paralyzing fear that they either find themselves essentially trapped in a situation or place, unable to leave without considerable difficulty or embarrassment, or that they will start to panic and no one will be able to help them. Some people with agoraphobia is able to put themselves in these anxiety-provoking situations. However, the dread it elicits is equally quite intense. Others, however, avoid the fearful situations altogether. The payoff of such avoidance is extremely powerful, and as a result, they literally become prisoners in their own home, never daring to venture outside. Even the smallest tasks, like picking up their child from school or running an errand, become impossible for them to do. Severe agoraphobia can prevent you from keeping your job outside your home, not to mention having any semblance of a normal life. It takes a severe toll on relationships, work, finances, and self-esteem, not to mention the ability to enjoy life. Without treatment, painful isolation and constant avoidance often end up defining the life for anyone who suffers from this challenging disorder. Types and symptoms of agoraphobia. Two types of agoraphobia are currently listed, and they are panic disorder with agoraphobia or agoraphobia without a history of panic disorders. For most people with agoraphobia, the fear often involves one or more of the following: being alone, somewhere away from home or even in their own home, losing control while they are in front of people, being in a crowded place, being in a confined place such as an elevator, car, plane, or boat, essentially any place from which they can't leave if they want to. Additional symptoms may include becoming very dependent on one or more than other people, the inability to leave their home, feeling of helplessness. The symptoms of agoraphobia makes it very difficult, if not impossible, to live a normal life. While some become confined to their houses because of their fears, others have a few safe places where they feel confident that nothing will trigger their anxiety. Cases of agoraphobia. As with many psychiatric disorders, science have not revealed the exact cause of agoraphobia. However, there are two factors that may play a role in its development. These include a history of previous panic attacks and the long-term use of certain medications such as tranquilizers and or other types of sedatives. Who is at risk? Since agoraphobia typically develops in the late teens or the early 20s, adolescents and young adults have the greatest risk of developing it. Females are more likely to develop the disorder than males. Other risk factors include a history of panic disorders or anxiety, a history of abuse during childhood, and problems with alcohol or drug abuse and or addiction. Accessing treatment. Fortunately, agoraphobia can be treated, although one of the biggest obstacles is getting the person out of the house and to the treatment setting. This dilemma can make some people with agoraphobia feel that their situation is hopeless. They believe their treatment isn't an option for them because of their crippling anxiety. And the solution to this may be as simple as looking onto the web for professionals who specializes in treating agoraphobia. Understanding the catch-22 of getting treatment for agoraphobia, some therapists will actually make an appointment to meet with you at your home. They may also offer sessions via phone, or just knowing that these alternatives are available can bring incredible hope for anyone with severe agoraphobia. Alternative treatment. Treatment for agoraphobia typically includes a combination of psychotherapy and medication, but one of the most effective types of therapy for agoraphobia is hypnotherapy. It helps you identify the negative and irrational thought patterns that cause or contribute to your anxiety. A skilled therapist can help you replace old, unhealthy thought patterns with new ones that will empower you. You will also be able to learn and practice new behaviors that will help you gain control over your symptoms. And now, with the modern technology, it's so easy to do a hypnotherapy session via Zoom, so the person does not have to leave their house at all. They can do the session in the comfort of their homes, and maybe only a few sessions is needed to really help them get rid of this problem and just live a normal life. Thank you for listening. I'm Chris Toit. I help people with agoraphobia, anxiety, and panic attacks. And have a great day.